Well, hello, everyone. My name is Don Lombardi. I teach at Stevens Institute of Technology in the School of Business. And today we're going to talk about leading during times of crisis and chaos and use some healthcare examples, lessons from healthcare. You're looking, ladies and gentlemen, a very fortunate guy. I've been working in healthcare for close to 40 years now, starting as an officer in the United States Marine Corps, where I worked in human affairs and other areas relative to healthcare. Then I worked for Cardinal Healthcare Corporation, major healthcare medical supply corporation. Then I worked for Bristol Myers, a name that's probably known to all of you. And then all through this, I've been teaching, and most recently at Stevens Institute of Technology. In the School of Business, I've been fortunate enough to have written 12 books in healthcare management and leadership. So again, very fortunate guy. I've consulted with over 160 healthcare organizations in all 50 states and in 10 foreign countries. But none of that means anything unless today I'm able to give you some lessons that we can use during these very crazy times right now with the coronavirus impacting daily life in America and indeed around the world. So what I'm going to do today is show you 5 different facets of lessons that we've taught people in healthcare, which they use, give you some vivid illustrations, some eruditions, some examples, and hopefully some tips that you'll be able to use as you manage and lead people in your capacities over these coming weeks. I'm sure we're going to get through it all. I'm sure the coronavirus is tough, but I think all of us are tougher. And I want to start out with a great quote, which is, when the going gets tough, the tough get going. And I'm sure that's what each and every one of us want to do, and that's what we're going to do and try to do in our video seminar today. So what I want to start with is, we're coming to you from a special remote studio in beautiful downtown Manalapan, New Jersey. And I'm going to start with a very simple premise, a tenet which we use all the time in healthcare, which is the performance matrix. And what happens, as you can see, is when you are thinking about the people that work for you, the people that you lead, they usually fall into 3 different categories relative to performance. We have our superstars, who we can also call our action agents. And these are our top people. These are the people where if I asked you about your organization, you would tell me these are your top players, okay? So these are your top players. It's not only what they do, but how they do it, okay? I'm gonna get a heavier marker for you. Excuse me, live television, all right? We know how to address performance, much better, right? We know how to address performance in terms of the what part. Okay, numbers, percentages, time, perhaps a fiscal cost. What becomes very important in times of crisis and chaos is how people respond. And in order to get to that, here's your first tip. Why are we doing what we're doing? And this becomes the basic imperative of any kind of leader in any part of the organization, any strata, any tier, to explain the why of what we're doing. The omnipresent why, of course, is there's a crisis, but we should always try to stress the benefit of what we're doing and what's needed to be done. Now, this is our biggest group. By the way, if you think about most organizations, and this has been my experience over the past 40 years in healthcare, is that this is usually about 10 to 20% of the organization. These are the people you turn to, making sure that the magic marker doesn't go through the paper there, otherwise I'm gonna have a crisis on my own hands with Mrs. Lombardi, but we're in good shape. We're going to look at this. This is your top 10 or 20% of the people who work for you. They love their job. They thrive on change and challenge. They are always there when you need them. They present solutions. They're the people, if I said to you, who are the best people who work for you? These are the people who come to mind immediately. So we want to keep them going. We want to keep them nourished. And we want to make them leaders. You know, in any organization, you have nominal leaders. Those are the people who have a title, you know, supervisor, department head, clinic chief, vice president, physician leader, nurse leader. This is in my field of healthcare. Those are nominal leaders. They have the name of the title. Your charismatic leaders are usually found in your superstars. The people who take the lead, the people who the other people, and again, this is your top 10 or 20%. This is where you're making your money, pun intended, but maybe not, with times of crisis, but in general, but particularly in times of crisis, are your studies. This is your biggest group. These are the people that look to your charismatic leaders. They look to you for support and guidance. And the studies are the people who strive to do better all the time. The studies are the people that you want to try to move up to that superstar category, all right? The studies are the people who ultimately define your organization, okay? They're very good technically. Sometimes they're your technical experts. I know in healthcare, when we do a profile, and this is kind of an organizational profile, and I encourage you, as you're tuning in at home, to go ahead and set up a sheet, superstar studies and non-players, and identify where each member of your team kind of falls into. This is your biggest group. This is the group you want to move up. This is the group you need to nourish. And I hope and pray you get something from our talk today. I hope and pray you get this. This is the group that needs you the most during times of crisis as a leader. They need reinforcement. They need that extra tender loving care. And here's your second big tip of the day. I hope and pray you get this. Taking the time to talk to them, letting them know that everything's going to be all right, that we're going to get through this, hearing them out. Sometimes people just need to talk, all right? This group is a group you need to get moving upward, all right? The group that you want, and I got to get my red pen for this group, the group that you want to make sure that you diminish their impact as much as possible are the non-players, okay? This group right here. This group, we hope, is 10% or less, okay? They're the people that always have a problem. They're the people that always have an issue. They're the people that try to bring down the studies if they can influence them. Here's where they become tricky. What they do sometimes is okay. They're very good at knowing the job description and where the line is, all right? And they're very careful not to cross that line. It's how they do their job, the negative effect they have, the second guessing, the passive aggressiveness, the thing where they always have issues, the thing where they always have to bring up problems, the thing where they want to have a conversation. And I quit touching my face when I was supposed to do that during coronavirus, and I'll make sure I do a better job on that. We all have areas in which we can improve. But this is the group, the non-players. We want to diminish their impact. Hear them out, but keep them moving. The studies, look at this. If we only spend 10% of our time on the non-players, 20% of our time on our superstars, heightening their performance, asking them what they need, keeping them moving. But we really nourish and dedicate about 70%, 60 or 70% of our time to these studies. We'll get them moving, and then they become organizational advocates. Great Latin derivative word, advocate. Means a positive voice. Okay, so this is a group that you want to zero in on. So your takeaway here is go ahead and set up a performance matrix chart for yourself, okay? And register where your players are. Now, I promised you some parables, if you will, from our work here at Stevens with the community, and particularly in healthcare. Let me tell you a little story about this. Several years ago, all of us in New Jersey, and indeed the entire metropolitan area, were impacted by Hurricane Sandy, or Superstorm Sandy. We were able to work with the Voluntary Nursing Association of Central New Jersey, which is now the VNA. These are all the home care nurses. These are the nurses and the medical professionals who run the methadone clinics, the rehab clinics, and what have you throughout the Garden State. 48 hours after Hurricane Sandy hit, we were able to work with them. We had a team of 12 Stevens students who I specifically selected, 6 superstars, 6 studies. All students, pre-med, business students from the School of Business, where I happen to teach, and worked in concert with nurses and medical professionals to get 6 tractor-trailer trucks to come up from the healthcare system, the Meritus system, down in Maryland, who went on a clothing drive. Within 48 hours, they brought up these 6 tractor trailers of goods. We got a warehouse in Asbury Park through the connections with the VNA. And we were able to get them to open up the warehouse. All of our kids unloaded the trucks, and we were able to open up the warehouse for all the community members of Asbury Park. Okay, and we basically distributed close to $250,000 of clothes, equipment, food supplies, and everything else that people needed after that beautiful seaside city got hammered by Hurricane Sandy. The superstars drove the action. The studies helped support the action. I didn't need any non-players, so I didn't even bother engaging them, okay? All right, so that's our first starting point. Let me show you what I got next for you. Okay, we'll get that. How's that? Perfect. Okay. The next thing in leading in crisis and chaos is to use the Pact Formula, okay? The Pact Formula is pride, accountability, commitment, and trust. Think about how these apply in a crisis situation. People want to have pride in what they're doing. They want to be accountable for the action. They want to have a steady commitment, and they want to be trusted, and you need them to be trusted in my world, in the world of healthcare, with the customer patients, certainly overall. I know at Stevens Tech, we try to take a really good care of our students. We have to make sure that our trust becomes an absolute. There's very few absolutes in human behavior. I'm an industrial organizational psychologist by trade. And I can tell you, in my years of experience, if you want to look at the ubiquitous literature and the statistics and everything else, trust is basically the only absolute. Now, I want you to watch what I'm doing here with these PAC factors. The first component is what you need to zero in on and focus on and get your team moving on during times of crisis. The second thing I'm going to show you in the second part of these, we call these couplets, okay, PAC couplets. We want to make sure that we try to, diminish that and not make it part of what's going on. Now, before we get going, remember, the eyes are the window to the soul, but communication is the key to action. So these are communication as well as leadership and psychological keys for you, okay? Now, as we go through these, the first thing you're gonna see, by the way, always important to hydrate during times of crisis, and I'm gonna do that right now. Jandan, cheers, okay? Fiji water, all right? Just Fiji water, by the way, if Dean Prostakis is watching this. Just water, boss, as always. And what we're going to do is look at these couplets. Watch how this works and make sure that you get these tendencies going towards the positive and not the negative. So the superstars in the studies will always want the first part. The non-players, unfortunately, revel in the second part of the couplet. So for example, all right, and I'm thinking specifically now about another crisis situation we had here in the New York, New Jersey metropolitan area, which was 9/11, which was horrible, as we all remember. These are keys we use with the Robert Wood Johnson Barnabas Health Group, particularly at Monmouth Medical Center, which is a Stevens Healthcare educational partner, Newark Beth Israel Medical Center, which is an interesting fact about healthcare, but you didn't know. The largest single employer in New Jersey, single campus in our biggest city, which is Newark Beth Israel Medical Center. That's why here at Stevens Tech, we call it the Mighty Beth, because they have 4,300 employees. Here's the keys we showed them, and I think they'll have application to you as well. You focus in on what you need to do. You don't worry about what everybody wants to do. Everybody will have something specifically they want to do. You want the superstars and the studies to zero in on what we need to do. A key for you as a manager, here's our third or fourth tip, depending if you're keeping score, clarity. You want things to be crystal clear. You want to keep them simple. You want to keep them to a 3 to 5 rule, which we'll talk about in a couple of minutes, a little bit more specifically. Do not be complex in your communication. Worst thing you could do, because then people are already a little uptight because everything that's going on. People a little bit on edge. They're trying to take care of their families. This all sounds obvious, I know, we're talking about it in a classroom setting, but you want to try to remember this as you go out and things are going 1,000,000 miles an hour in a 55-mile-an-hour zone. This is the #1 key. If I had to pick from all 12 of these, I guess we got, 12. Solutions, not people's problems, not people's issues. Here is a great house rule for you to use immediately. No one is allowed to bring up a problem or an issue without presenting a solution. It's an absolute rule. If they're intelligent enough to come up with a problem, and again, the non-players even, a lot of times might rise to the occasion, which would be a happy surprise. But the way to make sure that you're getting that kind of efficacy is to always ask for solutions. And if they're intelligent enough to come up with the problem and define it ad infinitum, if not ad nauseum, they surely can come up with a solution. Outcomes we're focusing on, not just opinions. We're focusing on what we can control, not the uncontrollable, not the if. I got to say something here. I appreciate the fact that a lot of these experts on the coronavirus are doing models and projections and everything else. I don't think there's a lot of value to every day talking about if this happened, if that happened, if the other thing happened. I can assure you, all of the great heroic people working in healthcare in New York and New Jersey right now, as they did during 9/11, focused in on what they needed to do. What's the next thing we need to do? What's the things that we can control? We want to be prepared. We want to be proactive. We just don't want to be reactive. But we can't respond to every if. There's going to be 1,000,000 ifs. And you know who's going to bring up the ifs are the non-players. So we want to make sure, again, to assure the studies, to ensure positive forward movement, that we're always thinking about what we can control, and we want to do a lot of listening, particularly to our studies. Not just hearing, not just, man, if I hear this word one more time, we need to have a conversation. Yeah, we need to have a conversation, but it has to be short, it has to be concise, it has to be to the point, and it has to come up with some solutions and things that we can do immediately. Never worry about 100% consensus in a crisis. It's never going to happen. You want majority commitment. Let's do the math. 20% superstars, 70% studies. You get that 90% moving the right way, you're in good shape. So you're looking for majority commitment. What's the majority think that we should do in a given situation as a leader? These are your decisions to make. But that's, again, why this is related to feedback and listening. Closure. Don't revisit issues. Once you moved ahead, one thing in dealing with crisis and chaos is you know that something new is going to be coming up over the horizon in a couple of seconds. So you don't have to keep revisiting issues. We have to move on. Be consistent, but don't be frenetic. I have to compliment, and you know, I don't use polemic. We don't do that here at Stevens, or political talk, or polemic, which is essentially a synonym for that. But I have to say, the two governors, Governor Cuomo, fellow Fordham fella of mine, and Governor Murphy, and I'm saying this objectively, are doing a really good job being consistent in their communication. Kevin Slavin, who runs St. Joseph's in Patterson, which is one of the safety net hospitals, which is in the Stevens Healthcare Educational Partnership, also happens to be the chairman of the board right now for the New Jersey Hospital Association. They've been terrific in being consistent, being proactive, and talking about the controllables. And I think that's why in Jersey, with this horrible pandemic going on, we've had at least manageable success. And again, we hope and pray that it's going to continue. And soon we'll be out of this. We're tougher than this virus. We want to innovate and not just be inventive. Now's not the time for anything brand new. Now's using resources that we don't have. So let me go back and tidy that up a little bit for you. Innovate means using resources that you have on hand, using them completely, coming up with creative ways of using them and applying them to the situation. That's innovation. Inventive is, gee, if we only had this, gee, if we only had that, yeah, that'd be great. But this is no time to be talking about that and having a conversation about it. Now's what do we got on hand? What can we use? Including even look at this beautiful brand new studio we have, because we can't use Castle Point. We'll be back at Castle Point soon, but for right now, this is great. Now, we all know the communication dyad, the receiver, okay? The sender, the person giving the message. In crisis communication, you have to, 9/11 was a great example of this. All the hospitals had to think in our neighborhood, among the 13 safety net hospitals we have, in Patterson, in Newark, in Asbury Park, in Camden, in Trenton, all the rest, specifically in our neighborhood. What do we know about what people are thinking? What are they scared of? What message do they need? And what do we need to tell them? Notice that the last thing I said was what we need to tell them. Before we even get there, we're thinking about what their perceptions are, what their thoughts are, what their fears might be. So you start with the receiver first, and then you figure out how to construct the message. Okay. So let me show you. We're talking about communication. So let's take a look at this. How's that? Good. Okay. Communication. Now, this is something, by the way, I have little notes for myself that I just jotted down here. These are a great tip in them themselves. Hopefully, don't use me as a role model for anything or a paradigm for anything. But I'll tell you, this is a good little tip that I learned years ago. Look at what I'm doing, okay? I'm using these, I call them power charts, because I'm trying to empower you and encourage you with this, right? Notice that everything I've showed you has had, maybe they've had 10 elements, like the last one had 12, but Pact only had 4 elements, right? So the 3 to 5 rule becomes really important. And what that basically means is any message, if it's less than 3, okay, what happens is I'm being didactic and I'm telling you to just, 1 or 2 things, that's it. And I'm not giving you the opportunity as a professional, particularly in healthcare, to kind of think about other ways of doing something, okay? I'm not gonna go over 5, because if I go over 5, I'm gonna flood you. Now, these are rules that we've given just in the past couple of weeks, we've reinforced with the 13 safety net hospitals in New Jersey, Beth Israel, Jersey City Medical Center. I'll go through, go through all 13 of them. But these are all safety net, which means they take everybody. So they used to be called charity hospitals. Believe it or not, they're all been in business since the 1800s. So they've all been in business a really long time. They're places that people trust. Hoboken University Medical Center is another one. St. Francis in Trenton is another one. All of these places, God bless these people. These are rules that we give to their frontline managers, all right? 3 to 5 rule, okay? You're telling people, you're not necessarily persuading them. They either get it or they don't. And if they don't get it, here's your rule, very important rule. If you tell somebody something more than twice, the same thing, they either don't get it or they don't want to get it, okay? Either way, you got to move on, all right? There's no such thing as over-communication. Absolutely no such thing as over-communication in a crisis situation. We tell this to people in healthcare all the time. It could be when you told somebody a message the first time, they were busy, they were preoccupied, they had a tough day at home, they didn't get enough sleep, which is certainly something which is going to impact all of us in the coming weeks. You want to make sure that you get the message, and if they say, oh, you told me that already, that's fine. You might get a positive outcome. They might say, you told me that, I had a chance to think about it, and here's an idea I had for you. So it actually sparks something that you could use, again, towards a solution formulation. The C's of communication: comfort, clarity, comprehensiveness. If appropriate, a little bit of humor, a little bit of comedy. We all need to laugh to keep from crying in these days. Being a little bit cheerful without being Pollyanna-esque or Jack Armstrong type, you know, rah-rah, is important, at least to be upbeat and to be energetic. You could play around a lot, and maybe we'll have another video seminar for you very soon on the C's of communication. Those are some quick ones for you. It's a good little tool for you to use to kind of check your communication, just based on what we gave you, but we can certainly provide you with some more. By the way, if you need anything at all on any of this, I'm an easy guy to find. Okay, on Stephen's email, BLOMBAR, Roman numeral 1, at stevens.edu. Anytime's a good time for an email. We're living on the email these days 24/7, so I'll get back to you right away. Which brings me to our last little tip: critical information, written. Verbal information, that's your first shot. If you want to make the information a little bit more permanent and a little bit more permeable, if you will, so people can respond to it, you go verbal. But then written information, email's great. I personally don't like text as much. I think email's a little bit better because you say to people, hey, let me check the email. Now, important tip. I tell all the department heads at our safety net hospitals, 24-hour rule on any kind of emotional issue. Okay, so let's say you have a bit of a short fuse. And every now and then I could be somewhat mercurial. If I get a message or somebody really did something they shouldn't have done while we're, in a time of crisis, I'll write an email. I'll put it in draft, or better yet, I'll put it in a Word document and I won't send it. I'll put a note at the bottom of it at the time that I wrote it. So let's say it's 11 o'clock on a Saturday morning. I won't look at that email until 24 hours later. And the reason for that is maybe the situation dissipated. Maybe I was a little bit too emotional in my response. Maybe I didn't cut down to the 3 to 5 things that were important in the message. Maybe I don't need to send it. Maybe it's going to resolve itself. But I want to anticipate what people's emotional reaction might be before I send it. 24 hours might move me from subjective to objective. Okay? Very good. Now, I got one more set of, I'm back. One more. There we go. All right. There we go. I got one more set of guidelines and tips for you. These are house rules. This goes back to another crisis situation I was involved with, this time not in the New York, New Jersey area, this time in Oklahoma City. You might recall, and those of you that are too young to remember probably read about this in your history books. We had a couple of very disturbed individuals, and I'm trying to be tactful, set off a bomb in Oklahoma City, a homemade bomb. I happened to be working there with my old buddy, my dear friend, Bruce Buchanan, who was running the Mercy Hospital system. And you can imagine the emotionalism. If you've ever been to the great state of Oklahoma, I love the place. They're a community, meaning a common unity. They're just absolutely wonderful people. So Mercy Hospital out there is not only their safety net hospital, it's kind of their beacon. And literally Oklahoma, by and large, in the western part is on a plain. This hospital is on a hill. I mean, it's almost biblical, the impact that they have on their community. What Bruce and I did was, for the managers, came up with, and here they are. We had house rules. Now we had 10 of them there, and you kind of get a feel for them. But we put them together, each manager had them in their pocket, and they were great guidelines during the crisis situation. What I'm gonna do is give you a couple of them, actually 8 of them now, which have kind of general application, and hopefully they'll have some value for you. First one, perspective means balance. We misuse the word perspective with the word perception all the time. Perspective means to have a balanced view of things, and you want to try to maintain that balance. You want to look for the triad of performance: motivation, ability, and knowledge. Now, we've been talking throughout our whole video seminar about taking care of other people. At this point, we're talking about you. Make sure your motivation stays fresh. Make sure your ability is where you need it to be. Try to connect knowledge every day. The best investment you can make right now is 79 cents to get a notebook. And in that notebook, as you get home, as you finally get done with that 12-hour shift, the stuff that we told the people in Oklahoma City, currently telling all the folks that are working at the safety net hospitals in New Jersey, make sure that you get some ideas down in that notebook every day. How many? 3 to 5 once again. I'll come back to this one. Take care of yourself. You know what we're doing right now, literally right now during the coronavirus, is I have a team of students who are putting together educational PowerPoints for the people that work at the hospitals. They're narrated PowerPoints. They're on things ranging from emotional intelligence to dealing with customer patients during crisis and all the rest. I keep telling them, I just had 3 or 4 emails just as I was setting up the computer today. That's the kind of students we have here at Stevens. Makes us very proud and happy, but again, Pact, very accountable. We're proud of them. They're committed. We trust them, but I need them to take care of themselves. So I tell them to watch the Tune Station instead of CNN. Listen to this. We get enough news every day on this crisis. We got enough news about the Oklahoma City bombing when that happened. All right. We got enough news about Sandy. Okay. We got enough news. All right. About the blackout over the summer here in New Jersey. Blah, 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 blah. People know that. All right. The networks are in business to almost oversaturate this stuff. So you know what to do? Put on the Cartoon Network, okay? I'm hooked right now on Mort, all right? What's the show? Rick and Morty. Great show, ridiculous show, silly show. But I watch it so I don't, just to get a break from the news, okay? Apple and Onion is real good too. I don't know if you've seen Apple and Onion, but it's talking food. Well, you get it. Watch some cartoons, watch an old movie, watch whatever you like. Unfortunately, we don't have sports right now. Read a book, all right? But make sure it's a book that has nothing to do about all the news, okay? Keep certain issues backstage, not on stage. In my business, it's very important because the patients are already scared, they're already alarmed. We've had a lot of different things going on now with visiting at hospitals. I was at a facility yesterday where visiting actually is stopped because they don't want it saturated. And people need to move around the hallways, if you think about that. If they need to blow off steam, the people that work at the hospital, take it backstage. They have an issue about a patient, keep it backstage. All right, they want to watch Apple and Onion on Toon Network, watch it backstage. I talked to some of we have a wonderful group of 7 scholar athletes who went to the NCAA championship for wrestling. They probably would have won, and this just isn't me talking, look at the record. They probably would have won the national championship last week. They canceled the tournament the night the guys got out there. I told them, hey, you know what? This is terrible. One of the students the other day, student athletes, great guy, 2-time All-American, by the way, said, hey, I learned that this is a disappointment. It's not a tragedy. Isn't that great? And they're all doing things now to help their neighbors. I'm sure that's going to sting. I'm sure it's, I can't imagine with all the work involved, getting short-shifted like that. But self-fulfillment is found in selflessness. Help somebody out, help grandma with the groceries. Help the people next door, all right? Go for a walk. I mean, that's my big thing. Go for a walk every day. Fill those lungs with some fresh air. Get out and about. Wave to your neighbors. Keep that social distance, okay? But get some fresh air. Get out there and make sure we're taking care of our community. Remember, community means common unity. And I got one last thing for you. Wonderful prayer. I don't know what your religious affiliation might be, what your personal beliefs might be, but here's a prayer that applies that all of us can use ecumenically, okay? Every day, ask the Almighty One, the man upstairs, the force of good, give me everything I need so I could be everything I need to be to everybody who needs me. Give me everything I need so I could be everything I need to be to everybody who needs me. In that vein, I wish you all the best. We're going to get through this, and I hope I was helpful today and gave you something that you might need during these times. We'll get through it all. Take good care and thank you.